Chronic sinusitis is a common condition. It affects the sinuses, which are air-filled spaces in the skull. When these spaces become inflamed and swollen for a prolonged period, it's called chronic sinusitis. This inflammation is often caused by infections, allergies, or other irritants. There are different types of chronic sinusitis. Chronic sinusitis without nasal polyps is one type. Another type is chronic sinusitis with nasal polyps. Polyps are soft, non-cancerous growths that can block the sinuses. Fungal sinusitis is another form caused by fungal infections in the sinuses. Each type of chronic sinusitis has unique characteristics. Understanding these differences is crucial for proper diagnosis and treatment. For instance, treatment for fungal sinusitis may differ significantly from the management of chronic sinusitis without polyps. Recognizing the symptoms of chronic sinusitis is crucial for early diagnosis. Common symptoms include persistent nasal congestion, facial pain or pressure, and a reduced sense of smell. Thick, discolored nasal discharge is also common, often draining down the back of the throat. These symptoms often last for 12 weeks or more, even with treatment. This distinguishes chronic sinusitis from acute sinusitis, which is usually short-lived. A doctor will diagnose chronic sinusitis based on your symptoms, a physical examination, and sometimes imaging test. A CT scan, for example, can provide detailed images of the sinuses, revealing inflammation or blockages. Endoscopy, which involves inserting a thin, flexible tube with a camera into the nose, can also be used to visualize the sinuses. Treating chronic sinusitis can be challenging, especially due to the role of biofilms. Biofilms are communities of bacteria that can form on the lining of the sinuses. They create a protective barrier that makes it difficult for antibiotics to penetrate, leading to treatment resistance. Several types of bacteria are commonly involved in chronic sinusitis, including Identifying the specific bacteria causing the infection can help guide antibiotic treatment. It's also vital to investigate and address any underlying conditions that may contribute to chronic sinusitis. Allergies, immune deficiencies, and structural abnormalities in the nasal passages can worsen sinusitis. Treatment options vary depending on the severity of the condition and individual patient factors. Saline nasal rinses, for example, can help clear nasal passages and reduce inflammation. Managing chronic sinusitis effectively often requires a multifaceted approach. In addition to medications like nasal corticosteroids and antibiotics, lifestyle modifications can play a significant role. Avoiding allergens, quitting smoking, and using a humidifier to add moisture to the air can help reduce symptoms. For some patients, surgery might be necessary to improve sinus drainage or remove polyps. This is typically considered when medical management fails to provide adequate relief. Early diagnosis and a comprehensive treatment plan tailored to the individual are essential for effectively managing chronic sinusitis. By understanding the different types, symptoms, and treatment options, individuals can work with their healthcare providers to find the best approach for their needs. By addressing both the underlying causes and the symptoms, individuals can improve their quality of life and reduce the impact of this chronic condition.